All right, welcome to the Float Pool staff meeting. Thank you to all of you that are here, and all of the rest of you will be watching this on the video, so that's great. However you can do staff meeting is great. That's our goal, is to make sure that you get all the information that we have at staff meeting. No matter how you get it, we're happy about it. So we're gonna start our meeting today by saying our mission. So if we can all say it together. It's at the top of your agenda. Ready? Above all else, we are committed to the care and improvement of human life. Our values are integrity, compassion, accountability, respect, and excellence. So our float pool culture is flexible teamwork, communication, empathy, and spread the positive vibe. So we have a lot of really great things that, Chastity, do you want to sign in? We have a lot of great things that we represent. Chandra's going to do our mission moment. She's our unit practice council chair. So go ahead, Chandra.
All right, so our mission moment is Jordan Brady here in Float Pool did a good job advocating for a patient on acute rehab. The patient needed continuous bladder irrigation and to be transferred to at least the medical unit. Jordan reached out to the doctor on several instances, stressing the importance of the situation and that the patient was not currently at an appropriate level of care. Jordan, Courtney on surgical, Shanda on acute rehab, and then Pamela, our house supervisor, all put in a good team effort to clear clots in the patient's bladder, which was of a significant challenge, and then to initiate continuous bladder irrigation until the patient could be transferred to a different unit as the doctor ordered. So he did a really good job advocating for his patient.
Good job. Yay, Jordan.
That's awesome.
Does anyone else have any other mission moments you'd like to share with us?
Everyone is awesome.
We really do have an amazing float pool. You all are so strong, and you just do such a good job of everything that you do. So it's a great group. All right, now it's Megan's turn for our leadership activity.
Okay, so we're gonna do some team building. I feel like we always have a lot of new people in float pool, which is exciting, but I feel like we especially have gotten kind of a big wave of new people that we haven't got together in person to see each other and know each other as much as we want. So we're gonna do some team building in the next couple of staff meetings just to get to know each other a little more. I know that the Float Pool Unit Practice Council is meeting more regularly and is going to get to know everybody more too and everything that we need, which is great. But I really want to make Float Pool feel like its own teaming unit, because it truly is. So all of y'all get to come stand in the middle of this table. We can bring the WebEx over there so you guys can hear us too. We can just put this in the middle of the floor.
Yeah.
So they can hear. And then those on the phone, we will get to pick the question for you because you're not here that you get to answer. But in my hand, I have something we call a thumb ball. A couple of you guys have probably done this.
It's okay, you can catch it.
So we're gonna pass this around. When we pass it around, does everyone know each other's names? Do we want to say names? I think we know each other's names, right? Should we say names? Okay.
Say names so
We'll
people on
say
the phone
names.
know who's talking.
Perfect. Okay. We'll say names, and then wherever your right thumb lands, that's the question you're going to answer. So, Yeah, please do. So, my right thumb landed on, I'm Megan, and what makes you happy despite any mood? Hugs from my kids, for sure. So, all right. I'm sure you say your name, and you don't have to wear your mask in this meeting if you don't want, but if you want to, you're more than welcome. So.
My name is Annika. What do you love or hate about travel? I guess airports?
Heat? Yeah. Pass it to anyone.
This is Chastity.
Oh, sorry, I'm Chastity.
We might have to be
Nice
careful.
again. What makes you happy despite any I've got the same one as you? I would say probably just hanging out with my kids. Bummer day, hanging out with the kids. Randy, ready?
Where my thumb lands?
Yeah, on your right thumb.
Someone you'd like to dine with or meet. I'd like to dine with just about anybody. if they're paying especially.
That's awesome.
Olga.
My name is Olga. Something you did that got you in trouble. Whoa, where do I begin? I guess it's just make sure everyone registers for their health stream on time. So they don't run out. They don't think about it in November, and no more classes to sign up.
Woohoo! That's the best thing so far.
Spencer says it's hard to hear on the phone.
Oh,
is it? Okay.
okay.
My name's Beverly, and it says last time you said sorry and meant it. Can't think of it. When I spilled water.
There you go.
There you go.
Good job.
Did you go?
Say your name.
Nikki. A new skill that you have with no effort, that you like with no effort. There's a lot.
What would you want to wake up and all of a sudden you could just do?
Mine would be to like go to the gym regularly and back.
Okay, that's okay. Do you want to do a different question? Okay, you can pass it.
Jordan.
You should have just thrown it at him.
This is Jordan.
I'm Jordan. Hello. One item on my bucket list. I want to see the Great Wall of China.
Right thumb. This is Caitlin.
Most memorable moment for what?
In your life, anything.
I don't know. I don't have one. Everything's
You
memorable.
just got married.
You just
I did just get married.
You won't tell your husband.
Yeah.
And you made your beautiful veil. That's memorable.
It's fine. No, it's good. No, I guess my wedding. Like everything's memorable. So
You went to Scotland.
everything's. I did go to Scotland. Alright. Already. The turning point in your life. I guess when I graduated college.
Yay.
Yay.
I think Chandra hasn't done it.
Have you gone?
I got it. Okay, right now. The age at which you became an adult. I still don't feel like an adult. I'm like, I need an adult. Oh, it's me. Okay, this is fine. Yeah, no, I don't know that I'll ever become an adult.
All right, Dan, can you catch it?
Okay, I got it. Okay, if I could have one room full of any one thing. Oh, I would love a room full of like butterflies. Wouldn't that be so fun to have a room full of butterflies?
I don't care about bugs. I do not like butterflies.
Flying around your head. Or
Yeah,
if they're,
that's
like,
true.
behind
I just think it would be so pretty.
Did you ever see the Hogle Zoo used to have like a
The butterfly room?
full of butterflies?
Yeah, they have one at Thanksgiving Point.
Do they?
Yeah, I'm gonna have to do that.
All right, Julia, I know you're on the phone. You're gonna answer the question. Ah. Sorry. What do you most value in a friendship?
Honesty and just always willing to be there when you need them.
Yeah, I love that. Always willing to be there when you need them.
Win is on the phone too.
Oh, okay. Wayne, this one's for you. Your 3 wishes. That's a hard one.
Oh my gosh, that's so. I don't know. Travel a lot. Get to see my family a lot, and I don't know.
Hey, those are 2 good ones.
That's
Okay.
great.
Who else is on?
Yeah.
Who else is on? Do you
Is
know?
Spencer on? Spencer's on.
Spencer. What do you? Oh, you got the friendship one too. What do you most value in a friendship?
Did you say Spencer?
Yep.
Okay. I value honesty and just them being there when you need it. So
Love
kind
it.
of along the same lines as the other one.
Kind of like the float pool.
Yeah. Being there when you need them. That's
All
exactly
right.
what we are.
Yep.
Kaylee, a chore you absolutely hate doing. You might be on mute if you're talking. We can't hear you.
Kaylee, are you there? Who else is there that we missed that's on the phone?
Can you hear me?
Yeah, now
Oh,
we can hear you.
Now we can hear you.
Someone honest, good at listening.
Oh, a friend? Okay, yes, perfect. All right, who else is on the phone?
Caitlin, housekeeper is.
Hey, Caitlin.
Oh, hi, Caitlin.
Okay, you're going to tell us the to-do list item that most reflects you.
Say that one more time.
The to-do list item that most reflects you.
So what is always on your to-do list?
Wake up at a good time.
That's hard when you're night shift.
Yes.
Did we get everybody on the phone? I think we did.
I think we did too.
Okay. All right. Thanks, guys. That was fun.
Okay, so the rest of this, we have a whole bunch of people in your float pool that are representing you in different committees. And so I wanted to give them a minute to talk a little bit about, now some of these committees are brand new, so they probably won't have a lot to tell you about them. But I wanted you to know who they were and what committee they're on. So we'll do Olga first. So Olga, tell us what committee you're on and anything you want us to know about that committee.
Yeah, hi guys. So I am on the Skin Integrity Committee, and I'm new to that role. So I'm still learning the ropes, but just a few things that we have done so far. About a month ago, there was a group of us and we did an assessment actually almost all the patients except for the family birth, and we checked their skin all over their body, and yeah, the results overall were pretty good. There are only a couple of patients that need to be addressed, but overall, yeah, everyone is doing a great job. So just carry on and make sure everyone checks in their patients every shift. Make sure to take a look, at their back, turn them around. If they're sleepy, make sure you ask a tech whenever they're changing them to take a look at their butt. And our diabetic patients, even if they tell you it doesn't hurt, just make sure to take a look at their feet, because a lot of the times there's always an issue there that can definitely aggravate.
Yeah, that's
all I
perfect.
got for you guys.
Okay, Alicia Johnson is on our Professional
Good job,
Practice
Olga.
Council. And so that is throughout the whole hospital. There's a nurse from every unit on that council. Alicia couldn't be here right now. She's working today. So our next one is Chandra. So she's our Unit Practice Council Chair. And so she can tell you a little bit about that.
Hi. So I am on the Unit Practice Council. There's a couple members. I'm your chair. Randy is your co-chair. Kylie Cannon is our secretary. And then we have Brooke Rice, Alicia Johnson. She's the one that is our Professional Practice Council. We have Chastity, we have Caitlin, and then we have Olga. Is that everybody, I think? And then of course Megan and Diane are also always there. The purpose of our unit practice council is kind of being a branch in between our unit specifically and then management and administration. It's a little forum where we can talk about things that are working well, things that aren't working well. We can kind of bounce ideas off of each other and see if there are ways that we can improve, or just kind of things that make our unit specifically function a little bit better. I think that we kind of have a really good opportunity in the fact that we kind of float throughout the entire hospital, working on making the entire hospital a little bit better functioning. Not that it is functioning poorly, but we're in kind of a unique role where we see it everywhere, so we get to contribute in a lot of places, which is really nice.
No, like truly though, I don't mean to interrupt you, but Diane pulled the numbers of how many shifts you guys covered on each unit. I should have brought it. It was...
I can pull it up. Let me pull it up because I sent it to you.
Yeah, we'll show you. Sorry, keep going. But you truly affect the hospital more than any of us realized. It's amazing. So
good. Good. And that's what we're there for. But so if anybody ever has anything that they think is working really well or it's not working really well, and you can reach out to any of these members and we can talk about it in one of our meetings. And that's pretty much it. We meet monthly currently, and then we're gonna start sending updates in the group me after our meetings, kind of talking about what we're working on, what we've accomplished, things like that. Currently, a couple of things that we've got going are the stretches that Caitlin's been doing. We're working on a potluck Friday, the first Friday of every month, just kind of doing some team building within our float pool unit. A couple of things from the last meeting that we followed up on and had accomplished are the ear oxygen probes. ICU was pretty much the only person that had those, and now they're available at telemetry by checkout for any patient that needs them, which is nice. We have a new employee spotlight, just kind of spotlighting members of the float pool that Randy did an awesome job on. Jordan was our first spotlight, and it's super cute. So just go in there and look on our little board. It's got, a little
so
about
fun.
me, lots of cute little stars. Randy did an awesome job with that. That way we can just get to know each other a little bit better. Just things like that. So don't ever hesitate to reach out to somebody if you guys see or hear or need anything.
So yeah, if you have anything, like these guys are your people.
Okay, here's the numbers.
Oh yeah. So I'll let you say them. It's amazing.
So in January, the float pool, and this is including the techs, this is including the nurses, this is all of us. In January, you did 39 shifts on IMC, 7 shifts on ICU, 53 shifts on medical, 104 on surgical, 63 on acute rehab, 17 on ACT, and 18 on BHU. In February, you did 54 in IMC, 21 in ICU, 54 on medical, 51 on surgical, 58 on acute rehab, 23 on ACT, and 23 on BHU. In March, you did 29 shifts on IMC, 17 on ICU, 39 on medical, 25 on surgical, 76 on acute rehab, 28 on ACT, and 36 on BHU. That is amazing.
So much help. Yeah.
Every single day, you are amazing in all of the shifts that you do. All right, the next one is Randy.
Not it yet, but I'm going to be joining the patient satisfaction. Okay, I'm going to be joining the patient satisfaction committee. We haven't met yet, but we just are here to help discuss how we can improve our patient satisfaction scores. And for me, the thing that I can think of the most that's just really important is those call lights, just be there as promptly as possible. And if you can't be, number 2, just let them know that when to expect that you'll be there. So
Yeah.
I will be bringing some more information after we meet, though. Coming up in May is when we're meeting.
Yeah.
So if you guys have ideas, let
Yeah.
Randy know.
Yeah.
And as you do every single shift, kind of think about, okay, what is going to make my patients happier with being here in the hospital? It's always really hard to be in the hospital, so that's one of the things that's a big goal. Okay, and Caitlin, is on. Go ahead, Caitlin, you can tell them what committee you're on.
It's our patient care tech committee kind of thing. It's mostly for, we haven't met yet as well, so this is like all kind of, it's a little bit mumble jumble, but we're not about patient satisfaction, mostly employee satisfaction. So like what can make your job easier and make you happier in your job. So fighting burnout and stuff, things like that. It's not, we haven't met yet. I'll have more information after we meet. So.
Yeah.
Do you know who the chair of that committee is going to be?
Not.
Diane.
Diane.
Of course
Okay.
I know, it makes sense, right?
So we will be having a meeting. But all these committees are like they said, a lot of them are new. We have a new committee representative on lots of these different committees. We also have had a couple people say they want to join the RISE committee. And so any of you that are listening or here, if you're interested in being on a committee and joining and helping, we have lots of opportunities. So we love to have the float pool involved in everything. So, and you can see we're going to be doing a lot of good work in the future too. All right, so we just have a few things, and these are specific from the Chief Nursing Officer, who's David Perkins. And you all know him, and there's some specific things he has us talk about every single week. So these are some of the things, and there might be some things from the meeting today. I missed most of it.
I did too.
So anyway, we'll get those to you if there's anything else we need you to know. So the first thing is pre-op checklists. So the techs, I don't know that this really affects you, but it affects all of the nurses. So the OR is saying that so many of the checklists aren't done, aren't filled out, aren't signed. And so just make sure that if you have a patient going to surgery, that as soon as you hear about the surgery, if it's right at shift change, make sure that that's your first thing you try to get done. I know at shift change it's really hard to get anything done, but if we can get those things done so that when they come pick them up for surgery, that those things are all taken care of. Make sure you look at every single page and make sure the patient has signed everything. If you have any questions about, there's so many checklists. The staff that's on surgical already are the ones that know the most. And so grab one of their staff members and say, hey, my patient is going down for this surgery. What do I need? My patient is having a heart catheter. What do I need? And they can help you the most. You can also call down to the OR and say, you know, if there's not anybody that you can ask, you could call down to the OR and say, hey, the patient is coming to you. Which papers do you want me to have signed?
There's two new things in that packet that are different just pretty recently. One of them is the SBAR form. Have you guys all seen that? The SBAR form that you fill out. It's a one-pager and it says SBAR. So there's that, that's new. And then the other thing is the stop signs. They're sticking out of the chart sideways. Have you seen that? The stops on the side. Those are the 4 things that the OR have found to be like essential. They won't take the patient from the floor if those 4 things aren't done because they just can't do surgery. It's mostly consents and yeah. Oh, thank you. It's mostly consents and like surgical site marking, things like that. So you'll see those 2 new things in the pre-op packet. And then they really are following up on if we're missing things, so we can give you feedback. Now I'm done.
For now.
Well, she'll probably have something to say on the next thing too. All right, the next thing about that they really want us to talk about is codes. When you have a code called in the hospital, whether it's a code blue, a code BERT, a rapid response, a code stroke, we have code pink. So we all know what to do with the code pink. We all go out in the hall and check everybody's baggage, their coats and everything. All the other codes, if it's not on your unit, please don't run to any other unit unless you're on the paper that you have a specific assignment to go. So they've been having way too many people come to the codes, and it's too much to try to deal with all of the traffic. So they've asked us to, if it's not on your unit, then don't go in there. Make sure that you know your role in a code. So if you're a tech, let's talk a little bit about roles in a code. So talk to me. I've talked to some of you about your roles in a code. So tell me, let's have a conversation. What is your role in a code?
Depends on what you signed up for, first of all.
Right, so in any code, if you're not signed up for anything, your role could always be to go get the crash cart. And I've taken a couple people on a little tour to find crash carts. So if you ever want to go on a tour to find all the crash carts so that you know where they are on every unit, then I'm happy to take you on a tour. You can always ask the unit that you're working on, hey, where's your crash cart? Because anybody can grab a crash cart and bring it to the room. If there's a code called, you probably always want, so anybody can do that. Another thing that you can do is anybody can also do compressions, because you all have been passed off on your BLS. So that's another thing that you can do. The house supervisor will be the one that's running the code, and so she will be the one, if she needs more, you can just make sure you put on gloves, stand outside the room, and if she needs you to come in and do compressions, she'll let you. If you have a student with you, we don't want them to come to codes. So a lot of times they want to come, a lot of times they want to see things, and did we decide one person?
We're gonna allow one observer, so if there's somebody orienting of our own staff, especially like RT will get to be first to orient.
So respiratory therapy.
Yeah. And then, you know, probably ICU nurse next, IMC nurse. So we'll let one person orient to codes per code. We just really got to declutter the room. It makes it more chaotic, as you guys have known and seen. So truly, if you don't have an actual assigned role for the day, you just ask the house supervisor, do you need help? And they'll tell you what you can do.
Yeah, and again, any of you can do compressions. We've had lots of people in this room that have done compressions, so yeah, it's a great opportunity, a great learning opportunity, but if it's not on your unit, don't come. Any questions about that?
Can I talk about our new code rolling out?
Yes.
So you guys will be the first to learn about this because I'm actually sending it out to the other nurse leaders tomorrow to communicate to their teams, but we are going to have a new rapid response code. It's going to be Rapid Response ED Assist. If we call that, that is when we have a rapid response that's a family member, a visitor, somebody in the lobby, someone who's not a patient currently in the hospital. When we say that, then someone from the ED is going to come with a stretcher. We're just going to get them to the ED as soon as we can. We can't treat them. We really can't do anything because the hospitalist doesn't have, they haven't admitted them, so they can't do any orders. They don't have the rights to take care of those patients unless they're admitted. And so they really just need to get to the ED, and that will make it a lot faster. We found that when we have visitor rapid responses, we just wait to get them to the ED, and it takes a long time. And now we'll just be able to get them on a stretcher and take them there. So we'll have a new code. We are gonna roll it out in the middle of May. I'll post it in the group me and keep reminding you guys, but when you hear ED Assist, it won't be any different for us. Like, it'll be the same rapid response team that responds, but the ED will also respond. So, any thoughts or questions on that one?
Okay. Yeah, one more thing with codes. If you are one that really wants to be the one that runs and does compressions, you can ask the charge nurse, hey, whoever signed up, hey, could I go instead? And so you can always do that. We're gonna go back to having the badges. Some of you remember when we used to have badges, and then on your shift, you would have the badge that says compressions on it. So if you want to do that, you can always ask the charge nurse, hey, can I be the one to be on compressions today? And you can wear that compression badge. So, all right. So the next thing that David Perkins wants us to talk about is taking a lunch. And so most of you do really good at this. He's specifically concerned, so there's two reasons. The first thing is he's concerned about you. A 12-hour shift is super long. It's really long to work without a break at all. So he'd really like you to take a break because then you won't get burned out as quick. You'll have a time for to take a few minutes and eat. Your tummies will be full. It's a time to take a little bit of a breather. We absolutely know that there are some shifts that it's pretty hard to take a break. But if you can try to take a break, that's the best thing. The other reason that we really want you to take a break is COVID has kind of calmed down a little bit. Some of you have been docked when we weren't docking anyone for a long time. So we're back to kind of, the volumes have come down just a little bit in the hospital. So we have to watch productivity a whole bunch. So that means we have to be careful and match the amount of people we have on the floor with the amount of patients. So if you take a lunch, you take that 30 minutes out of your day, then it helps us with productivity. So it helps you to refuel, but it also helps with productivity. If you don't take a lunch and everybody on the unit doesn't take a lunch, it's really hard to get approval for more people to be hired. For what else, Megan?
So when we ask to buy equipment, like the Ear SpO2, wow, I cannot think right now. All the equipment, we've bought so much equipment, all the things, in order for them to say yes, we have to be making productivity, making budget. All the bonuses we got was because we were doing that. So it's super important just so we can help our teams be successful. So yeah, it seems hard at times though, it does. We completely understand. So it seems hard, but it's how the business is run, so.
Yeah, so we just kind of wanted to talk to everybody about that. Try to take lunch if there's any way at all. Sometimes if you want to take it early in your shift, because you know, oh, this will be the less busy time, you can take it at any time in your shift, but try to take it as much as you can. Okay, the next one is vital signs. So we want to make sure that those vital signs are getting into the chart. So the vital signs that you take every 6 hours, every 4 hours, if they're ones that we're doing right after a post-op vitals, we want to make sure that they get in the chart. So we want to make sure that you all know that those machines that we have on all the units don't automatically send them to the chart unless you tell it to. So just because it's going in the machine, it's not sending it to the chart. So we've been doing some audits lately to see how many vital signs are in the chart. And we know that you're taking them, but not all of them are getting to the chart. So let's have maybe a little discussion about how you get those vital signs to the chart.
Tell them to do it?
Yes.
So if we're gonna do it from the mobile vital signs card, you need to sign in and with your name. And you can ask somebody there to show you. It's hard to not have a demonstration monitor right now. And then you also have to scan in the patient's name. When you sign in your name, it'll ask you your name and your password. And then you'll want to do, like if it's going to be post-op, so you'll want to push the interval button. And make sure you do pull somebody aside. And sometimes you might have to be shown a few times because there is a lot of steps. So you pick the appropriate, how often you want the vital signs to be done. So if it's post-ops or if it's every half hour or every 15 minutes or whatnot. And then you push start and make sure they're all hooked up. And then it'll start doing it. And you don't have to be there. But then along the bottom of the screen it will say review, and you need to push that. And then you push one that's return, that's also on the bottom, you'll see it. And then you can go in and pick each vital sign that you want to be sent to the chart. And make sure, again, just make sure you have somebody show you, even if they have to show you a few times. And then it'll be to the chart. If you're gonna do it from the ones on the wall, like especially in IMC, that's different. I don't know if we want to discuss that one right now.
Yes, we do.
Okay, so.
Yeah, you're awesome.
So that one you send it, that one will take it automatically, but you have to do in Meditech, you have to go to the monitor. On the right hand side of the screen it will say monitor, and then it will say like, basically it'll ask you like, well, when do you want it to start? When do you want to start seeing the vital signs that we've collected it in the room on that patient? And so you'll just say like start time, and then again it's a similar thing. It'll come up and then you click each one that you want and send it, and it'll post it to the chart. So
I just have been doing it manually. I didn't know, like I would go back to the Meditech and put it in.
Yeah, ask. Or you can always go in and do it by hand too, but that's just harder. So.
And I know at IMC they have those forms.
I can show you on IMC.
Yeah.
I don't know what forms you're talking about.
So just the paper forms.
The vital sign chart, it's got the patient's name, and then you can document all of their signs for each one.
Yep.
Well, if you work surgically, you can be sure that it can be one shift that you sign out the old
Yes.
user and you sign in as a new user. your patient's vitals.
I've not worked for like 3 days before and come in and still been signed in on all of the vitals machines on surgical. I was like, oh, this is fine.
Yeah.
So when we were on surgical, I was like, we had patients that had already came back from surgery, and so they were probably on like their hourly post-op vitals, and so I was like asking them like, when do I need to go in? And so they said it was automatically running, so I don't need to do anything at that point since someone had initiated it.
Right, so but you still have to send them. So they don't send to the chart ever unless you push that button that says send. So maybe you can have someone show you the next time. When do you work next?
I guess it was because I just had one surgical, so yeah.
Yeah, but I can show you, or someone can show you, no matter which unit you're on, because they can show you this.
Because I was like, ask the nurse, and they said, like, don't worry about it. Like, that one's taken care of. And so I was like, okay. And so I didn't. So I wasn't sure if those were getting quicker. Because I was assuming they were checking on it.
And then you can look too under that patient.
Yeah, I did.
And push the review and look, it's like, oh, did it come in?
I always check and make sure it's actually cycling too, because there have been a lot of instances where they're like, oh yeah, they're on, post-ops, and I walk in and I'm like, no, they're not.
Somehow it gets stopped.
Yeah,
They
so
have
if
it
it's,
set for 15-minute intervals,
Yep.
nonstop.
Yeah.
not actual post-op vitals.
And that's exactly what we think is happening a lot, that you guys are doing the work,
Yes.
but you don't get credit for it. You know what I mean? It's because it's not getting sent. So.
And it takes a minute to learn it. Like Randy said, the first time I ever had to do it, I had to be taught like 2 or 3 times.
So did I.
Like, it's not something that's just easy to learn. So don't feel stupid about it. If you don't know it, just go, okay, you gotta show me again.
Or you'll do it and then you won't have to do it for a while, and then you're like, oh, I need a reminder. It's okay to ask, because it's better just to do it. Get it
And
down. And once you get it down, then you'll be the one to tell somebody else.
Yeah. Yes, and IMC is different than medical and surgical. So their medical and surgical have the carts that you take around, but IMC, it's on the wall. So that's the other thing that kind of gets you mixed up, because you do it one way on one unit and then another way on another unit. So yeah.
I still remember my first time when I was like, a nurse coming in, and I had no idea how to set up the vital signs post-op. And I was like, Maddie, can you show me? She's like, oh, no, really? Okay. And I had to work the next time, I don't know, in a couple of weeks back in surgical, and I didn't remember how to do it. So then I had to ask Nikki, but they were so nice. I was just like,
Once you get it, it's like riding a bike, you'll always know it. But it might take a few times.
Yeah. And again, I think the other thing you think is, okay, they're all in there, or they said that they're all in there, I don't have to do anything, but then none of them are sent. And so that's what we're finding is we know that everybody knows how to do them, and they know that that's part of their job, but then whether they get sent or not is another thing. So I would say anytime you're in the patient's room and you have them on the screen, make sure you look and see if they're sent. So anyway, yeah, I know you're doing them.
you know how to tell if they're on intervals too, right? Yeah, it'll have the like little time clock thing underneath on like the blood pressure, and it'll say how long until it's gonna cycle next. So you can make sure they're on 15, 30s an hour or whatever, just quickly.
Yeah. So I think that it's exactly like what we thought was happening is, sometimes you just don't know that they're not getting into the chart. I've also had people tell me, oh yeah, whoever trained me said that as long as they take them, that just goes to the chart automatically, and they don't. So, okay. The next thing is around blood sugars. So make sure that you don't use the emergency bar for the blood glucose. So when they were talking about that, I didn't even know what that was.
I don't know what that is either. I know you can.
Great.
So I know you can bypass it and do like 0, 0, 0,
Yeah,
0,
don't worry
but I
about
don't
it
know
then.
about an emergency.
Yeah, that's good that you don't know the emergency code. So that means that you're all
We
doing
didn't
it right.
either. We're like, I don't know where this is coming from. Yeah.
Yeah. So I didn't know there was an emergency one either. So just don't worry about it. If you've never used the emergency one, just keep doing it. The way you do it is you scan the patient. So that's the way we
wait,
do
is
it.
there a faster way?
No. There's an emergency button, like
Just scanning?
if you were taking somebody like a patient's family member, if they were feeling like they were really not feeling well and they wanted you to take their blood sugar,
We couldn't do that legally anyways.
right.
Then you go to emergency.
You really shouldn't.
No, because then we're liable.
Yeah. And also if you poke them and they get an infection. Yeah. So you really should not ever use that emergency code. I guess they have seen some people, so I'm glad it's none of you. That's good. So yeah, just don't use it. All right, so the next thing, once you discharge a patient, if you can get them out of the computer as soon as possible after you discharge them, like as they're walking down, you know, one of the techs is taking them out, if you can get them out of the computer, you can always go back and chart anything you need to chart on them. But it helps everybody. It helps the flow of the hospital. It also helps our environmental services, so our housekeeping. If you don't get them out of the computer, they don't know that they're gone. They don't know to come and clean the room. And especially with the high cases we've had in the ER, then they don't come clean the room, then we can't get it turned over, then we don't know exactly how many patients are here in the hospital. So if any of you nurses don't know how to go back in the chart to chart anything you need to, you can let me know and we can show you. So, yeah. So just be the ones that immediately get them out. Just take them out of the computer. If you need to come back and chart, you can chart later, but please take them out of the computer as soon as possible. So basic infusion. This is for the nurses when you're running anything through the IV pump. David doesn't want us to use basic infusion. I had never done that, but Megan has a story about it.
Oh, that's just like all I ever used for any IV fluid. So I was naughty, I guess. I didn't know. But you know how you can pick basic infusion? We don't ever want to do that. That actually should be labeled something like emergency infusion. You should only do it in absolute emergencies if you had to. You want to pick maintenance IV fluid or whatever it is that you are running. Pick that. If you don't have the fluids or the medication, whatever it is in the pump, then you need to call pharmacy because they want to add it in there. It's kind of like scanning a medication. Another double check for you when you're putting it into the pump. If you pick basic infusion, you might do the wrong rate, the wrong med, wrong anything, and you would never know. And so it's just a safety feature. The division looks at really closely, and our hospital uses basic infusion a lot. So yeah, so don't ever use basic infusion.
And I didn't even know what that was.
Diane's so good.
Well, no, but Megan got taught that way when she was first learning at Lakeview. So, you know, so if the nurse that taught you to use basic, then don't ever use basic.
And go back to them and say, hey, don't use basic.
You're not supposed to use basic. Okay. All right. The next one is concerning our dialysis patients. So if you have a dialysis patient that has a fistula, please don't start an IV in that same arm. You can use the other arm. The hand is the best place for a dialysis patient to put an IV. The reason being, if they have a fistula and it stops working and they want to use the other arm, you can really kind of damage the veins if you're always using that for their IV access. And we had an instance a few weeks ago where the patient came in through the ER and the nurse put the IV in the same arm that he had the fistula in, and they were going to redo the fistula. And anyway, the IR doctor was really angry. And they were like, why don't your nurses know not to put an IV in the AC of a dialysis patient? So we thought we should just let everybody know. Just be a little bit aware. All right, the next one. Call more often for a code BERT. So if you are sitting with a patient or if you have a patient on the floor that is a little bit agitated or little unruly and you're a little anxious about it, just call a code BERT. They would rather come and get the patient calmed down sooner rather than later. So every single one of you, whether you're a tech or a nurse or whatever your job is on that unit, if you're a sitter for that patient, just call a code BERT if you're concerned at all. And you know, you've all been involved with a code BERT. The whole team comes up. We have a really amazing team down in the BHU, and they come up, they bring all their stuff, they've been trained, as have all of you, on de-escalation for these patients. And so let's get them calmed down, get them some medication if that's what needs to happen. But please do that sooner rather than later.
Our new security guard, Jordan, is fantastic. I mean, they're all great, but he, if you have a patient that is kind of combative or just might possibly be trouble, If you just call and let him know, or just stop him when he's walking by, he'll like increase his checks and make sure that he's calling the unit and being like, hey, you good? You guys need anything? He does a really good job. So if anybody's ever nervous, he'll make sure to walk around extra, which is awesome.
We also have a panic button for anybody that wants it. If you're sitting with a patient, doesn't matter what kind of patient it is, you can ask. Security has panic buttons, and then what that button does is it doesn't make any noise. You just press it and it alerts security, and they come immediately. So you can always ask for those. What else? We've been sitting a lot lately.
Where do we get those buttons?
You just ask security. You can ask the charge nurse, they can call security. You can ask the house supervisors, they can call security. If you see security in the hall, you can say, hey, can I have the panic button? Let's talk a little bit about some of the sitter patients that we've had. So let's talk a little bit about where do you sit if you're sitting with a patient? Outside or
Unless it's an SI, then you have to be within 6 feet.
yeah.
We'd actually rather have you right by the door but inside the room with any patient unless you are in danger, just because you can respond a lot faster and you don't get distracted by the hall stuff.
Make sure you're by the door though, so that you've got a way out.
Yeah, you can never be in the corner, but yeah, right by the door. Yeah.
And is it your job to stop the patient if they get out of bed and are running down the hall? No, it's not your job. We let security do that.
We want you guys to be safe, so if it's gonna put you in danger, just step away.
I was down in the ER one time, and they had a patient, they always have psych patients down there. And we had a family birth nurse that was sitting, being the sitter for him. And he takes off his clothes and goes running down the hall. And she was just, am I supposed to catch him? And I said, oh no, don't catch him. But he's naked. I said, yeah, it's okay. Security will take care of him. So it's okay. We see lots of streaking people. It's all right. So yeah, be safe. Anything else any of you want to say about any of the patients you've sat with?
Mine called 911 the other day. That was interesting.
In the room, you call it, they
Yeah, we didn't know.
Nobody knew.
No, he picked up the phone and he mumbled something, and here goes Jordan. You okay? So yeah, interesting.
We have just made so we had your sitter dates in the house supervisor office. We've just printed off a list of all of the PCTs, CNAs, everything, and so the house supervisors are trying to keep more track. It's really the charge nurse and the manager's nurse to keep track of all of theirs too. So they work together to make sure that everybody's having a chance to sit, so it's not always the
Yeah, and it's actually everybody's own job to keep track, to make sure it's up to date.
Yeah.
Yeah. So if you sat or you floated or you docked or anything like that, go in the house soup office, make sure your date is up to date. Or if you got docked, you're like, hey, just double check with the house supervisor. Did you update my dock date? If you sat, did you update my PSA date? But it's totally your responsibility to make sure that's updated. So they're all in the house soup office, and it's everybody's responsibility on the floors too.
Yeah. So it's not just yours. So that's good. We've tried to make that a little bit better for everyone.
And that's truly only just because then it will be the most accurate.
Yeah. So just make sure you swing by. Your locker room's just right down the hall anyway, so you can swing by and check.
I kind of have a question on a specific sitter patient that I won't go into super detail about, but he's been here for a minute and was just recently prescribed something because he is sexually frustrated.
We took care of that today.
You did? Okay, because as a sitter, like being in a room with somebody that's just not.
Yeah.
I mean, it's not necessarily fun regardless, but adding in things like that is just, it's just a lot because you're supposed to be watching them, but it just feels super inappropriate. So.
Yeah. No, thanks for speaking up.
Okay.
Yeah.
Thank you guys for taking care of that.
Mm-hmm.
All right. Anything else that any of the rest of you have? All right. We have a survey coming around in May 16th, right?
Yep.
And so on our last survey, some of the float pool said they would like to be recognized more. So we've tried in the last 6 months to try different things to recognize you. We've tried the notes, we've tried all kinds of different things. But I wondered if you could, if you just will turn your paper over and write how you like to be recognized, and then you can turn it into me. You don't even have to put your names on it. Just turn it into me. Those of you that are on the phone or watching this, if you would just let me know. Different people like to be recognized different ways. So some people like to, ta-da, look at, you know, what amazing things you do. Some people like the notes. Some people would rather just somebody say something to them. So I would just really like to know how each one of you like to be recognized. So we'll take a few minutes and let you write that. Yes.
I normally have to put my scrubs someday.
If you're willing, write your name on it, so then we can make sure that we do personally recognize you the right way, because we want to. So.
First of all, it wasn't even working. Okay, does anybody else have any questions, concerns, comments? Anything else you want to talk about?
When the engagement survey comes out in May, we will bug you like we always do to take it again. And that's just because we do want to hear your voice and hear what you guys feel like are our greatest opportunities to work on, to help you guys be happier, to make your jobs easier. Since the last two things that you guys said were recognition as well as resources. And I know that it's not in my head right now, but we have bought a lot of equipment. If you look on our huddle paper every week, it will say all the stuff that we've bought, and then just keep letting us know other equipment you need. Have you noticed a difference that you have more equipment that you need? I hope you're not always scrambling for stuff. If you are, please let us know.
And we're working on medical. So yeah, and you should look at our stoplight report in your break room, because we've put everything there, and you're more than welcome to. There's stickies in our little white box there. You can put things on the stoplight report too. So
I have a few things that came up to my mind. We're still filming.
we're still.
If they're kind of okay, well, one thing is kind of for everybody. The doctor phones. I kind of mentioned that on one of the meetings. The iMobile and the separate doctor phones that we use, and I just feel like we as nurses, we talk about it a lot, that a lot of the hospitals, they don't log into iMobile, and then a lot of the times they don't respond for a long time on the doctor's phone. And then sometimes they text us back, and that we don't look at that phone because we're mostly communicating with lab, with everybody on iMobile, especially like MedSurg. We're like, we don't have time. If we're waiting for a response, then we might go check. But if someone texts us and we don't know that they texted us and they want to hear back, we're not looking at that. So I think there's a lot of confusion and misunderstanding because of that, and we kind of talk about it between us, but we're like, well, I guess they just don't log in, that's how it is. But if And I know that it is a lot for them also to be communicating with all these doctors and nurses on different phones. But if they agree, the hospitalists, I'm just talking about the hospitalists. I know that surgeons, it's a different story. There are so many of them. But if they all log in, people that work that day, and we know who they are, people that we communicate constantly with throughout the day, I think would be helpful.
Yeah.
So the hospitals have a new leader. Dr. Belcher is their new leader. And he's honestly been so great to work with and really responsive. So Diane and I meet with him every month, but we talk to him even more than that. Let us talk to him and see if we can get him on board to all log into iMobile, because I agree with you. It's a hard thing. Yeah.
And a lot of them do log in, but there are a few that are just like, no, that's like not for me.
Yeah, let's see if we can get them to all do it.
Yeah.
Help. It's a
We'll
good
talk to them.
suggestion.
Yeah, another thing that I used to do when I was working on the floor is if I knew I would text the doctor and then I had to go do something else, I would say to the charge nurse, or if I was the charge nurse, people would hand me the phone and say, I just texted him, will you let me know when he texts me back? And then the charge nurse who is normally at the desk a little bit more, maybe can let you know. So, but I think that our best bet is to talk to Dr. Belcher and see if we can get them all to log in.
I think one of the hardest times is when it's not quite like a rapid, but your patient needs a lot of extra attention, and so everybody's kind of in that room congregating, trying to get stuff done, and then the phone is like sitting on the charger at the desk and nobody's over there for an hour because you're grabbing labs, you're doing a chest x-ray, you're trying to stabilize this patient. And you don't necessarily need all of the additional resources, you just need your doctor.
Yeah.
Yeah, sure.
Yeah. What else? Yeah, you gotta go clock in. Okay, so all of you make sure that you write in the exception book so we can pay you for the time that you're here. Any of you that watch the video, make sure you write in the exception book. Thank you all for all you do. You are amazing. You're an amazing team. So thank you, every single one of you.
Yeah, thank you guys.